Yesterday, CDC reported 46,318 new cases of COVID-19. Our 7-day average is at about 37,700 cases per day, and this represents an increase of 53% from the prior 7-day average. The 7-day average of hospital admissions is about 3,500 per day, an increase of about 32% from the previous 7-day period. And the 7-day average of daily deaths has also increased to 237 per day, an increase of about 19% from the previous 7-day period. Today, I want to speak about our need to come together against a common enemy, SARS-CoV-2 and the Delta variant. The Delta variant is spreading with incredible efficiency and now represents more than 83% of the virus circulating in the United States. Compared to the virus we had circulating initially in the United States at the start of the pandemic, the Delta variant is more aggressive and much more transmissible than previously circulating strains. It is one of the most infectious respiratory viruses we know of and that I have seen in my 20-year career. We recognize that some of you are still thinking about whether you will get vaccinated. Maybe you're seeing your local officials stepping forward publicly to get vaccinated, or maybe you're watching on local news that your community hospitals are getting full, or scarier still, maybe COVID-19 sickness has tragically hit you or your community closer to home. If you are still on the fence, if you still have questions about the vaccines, we welcome them. My request to you is this: ask your questions, talk to your healthcare provider, talk to your pharmacist, talk to your friends and neighbors who have gotten vaccinated and get your questions answered so that you feel comfortable and informed in making this critical decision. And please continue to do the things that we know worked to protect you and your family until you are fully vaccinated. If you are not vaccinated, please take the Delta variant seriously. This virus has no incentive to let up, and it remains in search of the next vulnerable person to infect. Please consider getting vaccinated and take precautions until you do. And if you've already had COVID infection, CDC guidance strongly recommends that you get vaccinated. It gives you longer lasting and more robust protection with the breadth and depth of coverage needed to conquer the variants currently circulating in this country. To those of you who have already gotten vaccinated, I know you are watching the rise in cases and have questions about what it means for you. I know you're probably worried about two things: whether you will still get COVID despite being vaccinated and which activities are safe. Let's start with the first concern. Being fully vaccinated gives you a high degree of protection against infection and an even higher degree of protection against severe illness, hospitalization, and death. That is what these vaccines were designed for and what the clinical trials studied, and the vaccines generally do their job quite well. These vaccines are some of the most effective that we have in modern medicine. And the good news is that current scientific evidence shows that our current vaccines are working as they did in clinical trials, even against the Delta variant. Importantly, our data show that infections are much less common in vaccinated people compared to unvaccinated, and most illness in vaccinated individuals is asymptomatic or mild. The most important public health step is to increase the vaccination coverage in all communities in the US and globally. There are places in this country where cases are high and cases caused by the Delta variant are also really high. And many of these areas have low vaccine coverage. In areas with high vaccine coverage and low rates of disease transmission, the chances of you coming in close contact with someone who is infectious is relatively low. In contrast, in areas with low vaccine coverage and high transmission, there is a much higher chance of you coming in close contact with one or many persons who are infectious. And that, in those cases, the greatest risk is for those who are not fully vaccinated. Whether you are vaccinated or not, please know we together are not out of the woods yet. And you will want to make thoughtful decisions to protect your health and the health of your family and your community. We are yet at another pivotal moment in this pandemic, with cases rising again and some hospitals reaching their capacity in some areas. We need to come together as one nation, unified in our resolve to protect the health of ourselves, our children, our community, our country, and our future with the tools we have available.